This is Stephanie Huff, and I am recording a concept on intracranial regulation. This lecture is going to be on seizure disorders. Just an overview. Seizures are defined as periods of abnormal electrical discharges in the brain that may cause involuntary movement or behavior or sensory alterations. Seizure disorders affect over 3 million Americans. Epilepsy is a chronic disorder characterized by recurrent, unprovoked seizures. This is usually secondary to a central nervous system disorder. Looking at the patho, seizures are believed to be related or to be a result of abnormal excessive electrical discharges in the brain. These are triggered by environmental, physical stimuli, and acute insults. It can also be from a physiological stimuli. Some of your triggers could be emotional stress, anxiety, fatigue, infection, or metabolic disturbances. Some of your acute insults are going to include central nervous system infection, hypoxia, and brain trauma. These are usually the most common causes in children. Partial seizures or focal seizures are caused by abnormal electrical activity in one hemisphere or in a specific area of the cerebral cortex. The areas that are most often affected are the temporal, frontal, and parietal lobes. Focal seizures may spread regionally, and symptoms are related to the region of the cortex that is affected. Your generalized seizures are a result of diffuse electrical activity that often brings in both hemispheres, then spreads throughout the cortex into the brainstem. In general seizures, movements and spasms displayed by the patient are bilateral and symmetric. Looking at the etiology of seizures, some are idiopathic, in which a no known stimuli causes it. There is nothing that provokes it. Your acquired seizures are caused by an underlying pathology. That might be trauma, infection, hypoglycemia, hypotonic dehydration, electrolyte imbalance, endocrine dysfunction, toxins, tumors, and lesions. Febrile seizures are generalized seizures. They are a result of a rapid temperature rise above 39 degrees Celsius, which is converted to 102 degrees Fahrenheit. It is usually in association with an acute illness. So usually they are sick with something, and then their fever rapidly rises, resulting in a febrile seizure. These are seen in infants and children. Usually they range from 3 months to 5 years. Usually the peak time is between 17 and 24 months. A lot of times they may have a family history of having febrile seizures. These febrile seizures can be simple or complex. Risk factors. Infants are susceptible to developing epilepsy during the first year. The median age for epilepsy is 5 to 6. The risk does decrease with age, so the older they get, the less likely they are going to be to develop epilepsy. Other risk factors would be an infant is small for gestational age, brain tumors, stroke, autistic disorders, neurologic conditions, infections of the brain, cerebral palsy, and drug abuse. Prevention. Everyone has a seizure threshold. If this is exceeded, then a seizure may occur. Some individuals will have a low threshold, which increases their risk for seizures. So maintaining a therapeutic regimen, avoiding alcohol, eating properly, and balancing activity and rest are going to be important in prevention. And that's because the frequency can be reduced by identifying their general triggers. And so those could be things like fatigue, hypoglycemia, fever, alcohol ingestion, hyperventilation, and menstruation. And those with epilepsy, a lot of times their trigger may be an odor or flashing lights that provoke their seizures. All right, your clinical manifestations. When we're looking at generalized seizures, initially they are going to be in the tonic phase. During this phase, they will become unconscious. They will have a continuous muscular contraction. The basal metabolic rate rises during the peak of the seizure activity. This increases the body's demand for oxygen and glucose. The patient may become pale or cyanotic as a result of hypoxia. They may also become hypoglycemic if the glucose demand is excessive. After the tonic phase, they will enter the clonic phase in the generalized seizures. In this phase, they will have alternating muscle contractions and relaxation. After this, they will enter a postictal phase following the seizure. During this phase, the level of consciousness is decreased. Client is sleepy, often arousable. The length of the postictal state will vary according to the individual. All right, so symptoms will depend on the type of seizure and the duration of the seizure. There are two main types of seizures. One is known as partial or focal seizures, and the other is generalized seizures. Your tonic-clonic seizures are going to be most common in children, and these are generalized seizures. An aura may precede the seizure activity, providing early warning signs of the seizure. Any type of sensory alteration ranging from odor and taste to vision is considered an aura. So when these patients have an aura, they may have time to avoid injury by getting to the floor so they don't end up falling on the floor. Febrile seizures involve generalized tonic-clonic movements. They generally last less than 15 minutes. All right, different types of seizure disorders. And there's a great table on page 717 and 718. But just to try to kind of go over some of these. Your simple partial seizures involve activation of only a restricted part of one cerebral hemisphere. So your manifestations, there's no alteration in consciousness that occurs with a simple partial seizure. Typically, only the motor portion of the cortex is affected, causing recurrent muscle contraction of face or a contralateral part of the body. Motor movement may be confined to one area. If it spreads sequentially to adjacent parts, it's called a Jacksonian march or a Jacksonian seizure. If the sensory portion is involved, manifestations may include abnormal sensations or hallucinations. Disruption in autonomic nervous system may result in tachycardia, flushing, hypotension, or hypertension. Psychic symptoms such as sense of deja vu or inappropriate fear or anger may be experienced. During your complex partial seizures, this involves activation of only a restricted part of one cerebral hemisphere, usually originating in the temporal lobe. Your manifestations of a complex partial seizure, they are often preceded by an aura, which may be visual, auditory, and odd smell, or psychic in nature. Impaired consciousness lasts for several hours before full consciousness is regained. It exhibits repetitive, non-purposeful activities such as lip smacking, aimless walking, or picking at clothing, called automatisms. Amnesia is common after a seizure. In your absent seizures, these are also known as petit-mal, P-E-T-I-T-M-A-L. They involve both hemispheres of the brain as well as deeper structures such as the thalamus, basal ganglia, and upper brainstem. Manifestations of this type: level of consciousness is impaired. Sudden brief cessation of all motor activity is accompanied by a blank stare and unresponsiveness. This is more common in children, usually lasts 5 to 10 seconds, sometimes as long as 30 seconds, and they vary from occasional to several hundred per day. Your tonic-clonic seizures are the most common type seen in adults. Your manifestations: warning aura may precede the seizure activity. It's usually visual, gustatory, auditory, visceral, or sense of uneasiness. They will have a sudden loss of consciousness. During the tonic phase, they will have sharp tonic muscle contraction, forcing air out of the lungs, which may cause the client to cry out. Loss of postural control, causing the client to fall. In opistotonic posture, muscles are rigid with arms and legs extended and jaw clenched. Urinary incontinence is common and may be accompanied by bowel incontinence as well. Breathing ceases and cyanosis develops. Pupils are fixed and dilated, usually last 15 to 60 seconds. This is followed by the clonic phase, and that is characterized by alternating contraction and relaxation of muscles in all extremities. Hyperventilation, the eyes will roll back in the head. Client froths at the mouth. It varies in duration and subsides gradually, generally 60 to 90 seconds. They will enter a postictal phase after this, in which the client remains unconscious and unresponsive to stimuli. They will be relaxed and breathe quietly. They regain consciousness gradually and may be confused and disoriented on waking. A lot of times they complain of headache, muscle ache, fatigue. They may sleep for several hours after the seizure. Amnesia is usually both for the seizure and several minutes before the seizure activity. Status epilepticus. This is a continuous seizure activity with only very short periods of calm between intense and persistent seizures. Seizures may be any type, but most often are generalized tonic-clonic. Client is at greater danger for hypoxia, acidosis, hypoglycemia, hyperthermia, and exhaustion if the seizure activity is not halted. So these are your different types of seizures, and you can see how they can all vary. As far as treatment for them, for your simple partial seizures, usually they're put on anti-epileptic medications, making sure that they're safe during the seizure. Your complex partial, again, those are anti-epileptic medications. Sometimes they'll do vagal nerve stimulation therapy for your simple partial and complex partial seizures if medications do not properly control their seizures. All right, on your complex partial, another thing that they may consider is a resection of the epileptogenic focus. And so it's basically where the focus of these seizures is coming from. And it's usually in the temporal lobe. For your absent seizures, these are put on anti-epileptic medications. Tonic-clonic, again, anti-epileptic medications. If people have lots of seizures, sometimes they make them wear helmets to protect their head. Driving privileges are suspended until seizure activity is controlled and the client is seizure-free for a period of time, and that's determined by the state. I know in Alabama, I know it used to be that you could not drive for a year after you had a seizure. Making sure that your client stays safe during the seizure is the important thing. Don't restrain the client when they're having a seizure, making sure that you're patting the side rails. Diazepam, lorazepam, and phenobarbital may be administered during the seizure to limit the length of it. Your treatment for status epilepticus is providing immediate interventions to preserve their life, making sure you establish and maintain a patent airway. A lot of times they may administer 50% glucose to prevent that hypoglycemia. Diazepam or lorazepam is administered IV and repeated every 10 minutes until the seizure activity stops. They will also be given anti-epileptic medications. All right, when you're looking at collaboration, the healthcare team is going to be composed of nurse, physician, family, and client. They are all going to work together to understand the care and prevention requirements. In case of children, the teacher, school nurse, and other adults that are working with the child are also included for care during school and extracurricular activities. Many seizures are self-limiting and require no emergency intervention, which just means that they will stop on their own without you having to do anything for them. Diagnostic tests, blood tests, include CBC, blood chemistry, urine culture, lumbar puncture. They'll do serum drug levels for the anticonvulsant or anti-epileptic medications that they're on that have therapeutic levels. Your EEG is done at follow-up appointments between seizures, and basically these are when they put electrodes on the skull and they're looking for seizure activity. So they're looking at that electrical impulses that will show up, and they will often do strobing lights as part of it to see if they can elicit seizure activity or increased electrical activity in their brain. CT scans, MRIs, angiography are done to identify cerebral lesions or metabolic disorders in the brain. They will also do lead levels and toxicology screens to see if that is the cause of their seizures. All right, your AEDs, those are anti-epileptic drugs. They are also called anticonvulsants. They are used and they can be used to reduce seizures or control seizure activity. So they do not cure the disorder, they only manage their manifestations. They do act in two ways. One is to raise the seizure threshold, and the second is limiting the spread of abnormal activity. So the goals of the medications are to protect the client from harm and to reduce or prevent seizure activity without impairing cognitive function or producing undesirable side effects. So pharmacologic therapy, status epilepticus, again, is a continuous seizure that lasts more than 30 minutes or a series of seizures. They do require immediate intervention to preserve their life. It's very important to establish and maintain an airway. Talked about IV, 50% dextrose is given to prevent that hypoglycemia. Diazepam, which is your Valium, lorazepam is Ativan, are given IV. They're repeated in 10 minutes if needed to stop the seizure activity. Phenytoin, which is your Dilantin, is given IV for longer term control. Phenobarbital can also be given to patients in status epilepticus. All right, so clinical therapies for children. Febrile seizures are not usually treated with anticonvulsants and meds at the time of seizure because typically they are an acute and usually they have stopped by the time they arrive to the healthcare clinic or to the emergency department just because they're so quick. So this just requires parental education as giving them antipyretics like Tylenol to reduce their fever, protecting them from injury during the seizure. And so the main thing is keeping them from hitting their head, and keeping things away from them if they have fallen on the floor that they could kick and potentially knock down on top of themselves. And that is for anybody that's having a seizure. So you just want to let them go, but don't try to restrain them or force them to be still, because you could actually injure yourself or injure them further. Basically, it's just keeping things away from them while they're having their seizure. Second febrile seizure is likely after they've had the first. They can give rectal diazepam or diazepam gel at the onset of the seizure. You may give before that to prevent a secondary seizure if the parent is severely anxious about the subsequent febrile seizures. All right, a generalized seizure lasting greater than 10 minutes. You want to monitor electrolytes, glucose, and ABGs. Watch for increasing fever. When you're monitoring your vital signs, you're looking for abnormal blood pressure readings. Most seizures are managed with anticonvulsants given IV or rectally. Need a seizure action plan for school and daycare, or if they're watched outside of the home. So they need to know what to do in case they have a seizure. You also want to monitor them for possible status epilepticus. Post-ictal period in kids can range from 30 minutes to 2 hours. You also want to monitor their serum drug levels to see if they're at a therapeutic level, or to identify toxicity. So your AED, that's your anti-epileptic drug therapy. Most of the time in kids, it's a monotherapy, and that's preferred, which is just one drug. And that's preferred in kids to minimize the potential for adverse effects like sleepiness and difficulty with speech. Sometimes an additional anti-epileptic may be ordered, but only if the seizure control is not achieved with the first med. But as the child grows, oftentimes the dose needs to be adjusted to make it therapeutic for their weight. All right, approximately 25 to 35 or 30% of kids have refractory or intractable seizures that continue to occur even with optimal medical management. These kids are usually referred to the epilepsy center for other potential treatments like ketogenic diet, vagal nerve stimulation, and evaluation for surgical treatment. So diet therapy, when you're looking at the ketogenic therapy diet, this is occasionally used for kids less than 8 years of age with myodonic or absent seizures as well. But basically on this diet, it is called a medium chain triglyceride ketonic diet. And this is used extensively in treating refractory childhood epilepsy. The child usually starts the diet in the hospital with a 24-hour fast prior to starting the diet. And they're trying to get them in to ketosis, so they're spilling ketones in their urine. And so the ketosis is believed to produce anticonvulsant effects. The diet is customized to maintain ideal body weight and maximize ketosis and achieve optimal seizure control. Family must be motivated to do this diet. The child is often on it for several years. Improved seizure control is directly related to the compliance with the diet. So basically, if they stop the diet, then they go back to normal and have lots of seizures. The child during ketone is usually monitored weekly. Most common complications of this diet are going to be constipation, hyperlipidemia, and kidney stones. And that is because it is high in fat, low in carbohydrates, and adequate in protein. If the child has been seizure-free for 2 years, they will do a trial with AED withdrawal. And so during this, the meds are slowly tapered over a period of months, and then finally they will discontinue it completely. Most of these medications do have to be tapered off so that they do not have withdrawal symptoms. All right, so after the first seizure, you want to make sure that you get information from the parent, primary caregiver, or witness to the event. And so you want to get a good history, and that is a description of the seizure. So you're going to want to know exactly what happened during the seizure. Did they stay alert? Did they fall down? Did they lose consciousness? What did their eyes do? What did their extremities do? You also want to know how long it lasted. Was there an aura present before? You also want to ask them things. Did they lose continence of bowel or bladder, or both? All right, a complete physical and neurologic examination is done. All right, so during the post-ictal period, you want to monitor their vital signs, do neuro checks, and ensure their safety. Once they're stable, a more definitive assessment can be done. You're going to assess their level of consciousness. Is one of the most important indicators of their neurologic function. Sometimes after a seizure, a lack of response may be a result of just the post-ictal state and not necessarily a sign of neurologic decline. All right, so this is a list of your NANA diagnoses that you may see in somebody that has seizures. So you can see a couple of them have to do with airway. They've got a risk for trauma, low self-esteem, and that's because they don't want to have seizures. They don't want to have seizures in front of people, which kind of goes along with their anxiety because they never know when they're going to happen. You also want to look at planning. So goals may include focusing on safety, maintaining their patent airway, administering medications. This may be during the seizure, after, providing emotional support, and acute long-term management of the seizures. Implementation. Probably one of the most important things is to not place anything in their mouth during a seizure. Any loose teeth can be knocked out and aspirated. You also want to maintain suction at the bedside to clear their airway. Never stick your fingers in their mouth because they will bite you. A lot of people think that they're going to swallow their tongue. Well, you can't swallow your tongue because it's attached. It can fall back and occlude your airway, but there's a lot of people that we'll talk about people that are afraid they're going to swallow their tongue when they have a seizure, so they want to grab it. You want to position them on their side so that the secretions can drain out and they don't aspirate on them. Monitor to ensure adequate oxygenation. Mucous membrane should be pink. Heart rate should be normal or slightly increased. Their oxygen saturation should be greater than 95%. If it's not, then you need to give them supplemental oxygen. Protecting your client from harm during a violent seizure is going to be important. If they're in the bed, the side rails need to be padded, and that's going to be to prevent injury. Frequent seizures, they need to wear a helmet to protect their head from falls. Also, they should wear some type of medical alert, jewelry, bracelet, necklace, just some kind of identification. Administer IV medications cautiously. and they were talking about the diazepam, lorazepam, and phenytoin. You want to give them all slowly to minimize the risk of respiratory or circular collapse. All right, continuing with implementation, you want to give medications for ongoing management of seizures orally. Crushing pills and mixing with a teaspoon of applesauce, pudding, or other soft food makes them more palatable and easier for children and older adults to swallow. Sometimes they have trouble with pills. You want to stress the need to treat the child normally because they already feel different, so they don't need to feel like that everybody's treating them different too. You want to refer to support groups if indicated, and that will help them cope, and sometimes that is good for not only the patient but also the family as well. You also want to encourage them to express their fears and anxiety, and then listen to them and kind of help them deal with their issues that they have. A lot of times it's just fear of the unknown and questions that could be answered. All right, evaluation. Expected outcomes may include that the client achieves good seizure control with medication, ketogenic diet, or surgical intervention. Client self-esteem is enhanced through participation in well-supervised sports and activities. Client maintains patent airway during seizure activity. Medication administration reduces the frequency of seizure occurrence. And appropriate seizure management plan is created by the client and family in communication with the healthcare team. So this is the end of the discussion on seizure disorders. And again, as always, if you have questions and need any clarification, let me know and I will help you to fix this.